So at this point, what I'd like to do is kind of open things up for the audience to be able to participate. Because we are webcasting, we need you to do two things. One, go to the mic, which some of you are starting to do. Two, say who you are before you make a comment or ask a question. And I would appreciate also if you want to make a comment, to make it a brief, very brief comment, because there are a number of people who want to participate. And so I can see that our first person to the mic is Dr. Melissa Perry. She happens to be chair of the Department of Environmental and Occupational Health at the Milken Institute School of Public Health, works with Dr. Zoda. Welcome, Melissa. Hi.
Thanks so much. Fantastic panel, very, very thought-provoking, very thoughtful. I was very energized about the multiple comments related to studying preconception, and was hoping that we could unpack it a bit further in what have the obstacles been. We're talking about what happens not only during pregnancy, and you can see there's been historically a strong emphasis on what happens during pregnancy, but also at the time of fertilization. So you can have a defective sperm and actually an oocyte that is effective at repairing DNA damage, for example. So certainly we can do that in animal models, but how about in population studies? Dr. Birnbaum, you mentioned that unfortunately there wasn't a preconception cohort that was part of your children's center model yet. But the question is, what do we need to do what have the obstacles been to setting up those human studies for studying preconception, and how can we overcome that?
Well, I think Rebecca basically talked about one of them, is that only 50% of pregnancies are planned. That's number one, so people don't know. I think we've actually been looking at, in our children's and our longitudinal cohorts, the idea of looking at the next generation. Now, part of the issue is we'll know who the moms are. I'm not sure it's always going to be easy to know the dads. In the National Children's Study, which no longer exists, there had been an effort to recruit partners before pregnancy, and it was very, very unsuccessful in that. But it can be done, as Jermaine Buck-Lewis has shown. She has recruited, but a cohort of 1,000 or 2,000 people, it probably doesn't have the power to ask some of the questions we want to look at. But we do think there may be some opportunities with these million-person cohort that's going to be formed with precision medicine, under this precision medicine initiative, to do some questioning there. We're hopeful that with some of the echo studies, again, there may be some opportunities there. But it's a very difficult, it's a difficult time to recruit people for these kinds of studies. But I think it can be done. I think it can be done, but it has to be done well.
Yeah.
Hi, I'm Jerry Poggi. I teach environmental occupational health policy here at GW. I kind of would like to get reflections in a different direction. Improving children's health, we know, is going to be contingent upon the vast flow of new research, but it also is going to have to involve the families, the communities that surround them. So I'd like to get some input on how do we improve our translational research into serving communities. I know the NIEHS has been a long-term supporter of public health partnerships. Do we learn anything from those partnership activities that could accelerate the partnering between those who are doing basic research in this area to solving the problems for parents and their children?
John, do you want to start with that in terms of getting the information out there, I guess, is a piece of it, which you've certainly been involved with. Sharing the information on the web helps communities considerably, I think, the right to know issues.
Right, so go to the ACE website, at least you'll know the data that we have there. Yeah, I don't know what else to suggest, but that's a starting point.
I mean, I do think that the NIEHS centers that have very strong community engagement components, and in some cases where the members of the community are actually an active part of the research teams.
That's actually not in some. In all of our centers, where there are environmental health core centers, our breast cancer and the environment centers, our Superfund centers, I'm forgetting all of our children's health centers, any of our centers.
Everyone.
All of our centers have a community, not an outreach, but an engagement core, where from the get-go, community members are key participants and investigators in the studies, because no one knows the environmental concerns like the people in a given community.
Okay.
And I think the media is another important component, right? So the media not only increases scientific literacy about these issues, but is another, important vehicle for disseminating our research. And I also think, to the extent that we can publish in open source journals, makes the information more available to a broader audience, as well as partnering with people in the NGO community, who are very skilled at leveraging the knowledge that we produce to create change.
So Lynn mentioned briefly our partnerships in environmental health, which is our overarching, our umbrella program that basically integrates all the community engagement cores and has them working together. They've got a very nice website with all kinds of tips and information on it. All of our community engagement cores work in the community and develop materials that are shared with members of the community and have a very strong educational component, including efforts related to K-12. Because I think we all know that scientific illiteracy in our country is, I don't want to use a not nice expression. Let's just say it's really, really terrible. And you've got to start getting to the children early. And so the K-12 is very, very important to get them involved.
I think also working with clinicians, and I think Dr. Clifton, some of the kind of work that you've been engaged with, where you're directly looking at a medical practice, well-intentioned, and founded on good science, good understanding, but it just happens that this practice doesn't work. But there are many things that practitioners could be engaged with in terms of helping with prevention, helping with managing exposures, helping to educate. We do know that many people trust their doctor as an authority about science more than they trust the government, for example. And that's, survey research tells us that. But especially the obstetrical community hasn't been as engaged as it should be in beginning to understand these things. They're trying to come in, but it's, this is an area I think where we can reach a lot of communities through the medical community.
So I have to say something. ACOG, is the American College of Obstetrics and Gynecology, has been a leader in the field of dealing, and so has the American Society for Reproductive Medicine. Those are two groups that are kind of leading the field along with the American Academy of Pediatrics related to environmental exposures. Obviously, there could be more information out there. Certainly, I'd like to see the family practice docs and the internists getting involved as well. And I can tell you it's hard to make some of those inroads, although, that doesn't mean, but clearly the pediatricians and the OBGYNs at least are some of the groups that are the most invested and the most interested in getting out information to their membership about concerns of environmental.
And they've come out with several scientific consensus statements as well.
Correct.
So they want to be engaged, and we need to develop the information and, if you may, the practices that they can use to actually on the ground do that. Yes, next question.
Yeah, my name is Yutaka Aoki. I work for NHANES, and I wanted to comment on Dean Goldman's first question about how we study BMI. How to study chemical exposure effects on the body weight and so forth. But just before I go to that point, in terms of the enhanced participation rates has been going down a little bit. So if you could help maintain the participation rate so that important data could be kept collected. But my point was about enhance is that there were some additional resources that could be used for the kind of research. One is enhance collected and also have some materials available for genetic data. So that's something kind of underutilized resources. And another point I wanted to make is that, enhance of course collects body weight and other body measurements, but the kind of study we could do typically is cross-sectional. And the question and the concern is the chemical cause the weight to increase or weight to increase cause the other. So there's actually research for this resource to do some longitudinal analysis using enhanced data. Using enhanced data as baseline, and participants could be followed up, actually passively, for mortality, their death. We have some data mechanism to use such data. Also for kids, especially, there's a linkage to Medicaid data. So Medicaid, I don't think there's a body weight or body measurements data from Medicaid, but there may be some clinical outcome that's very closely related to obesity. Some like a cholesterol measure, pre-diabetic condition. So that's a sort of a one way to do longitudinal analysis linking exposure to obesity-related health outcome. So I just wanted to promote. Sorry, so self-promotion.
Thank you for that. Thank you for that. I don't think it requires a response, but does anybody want to?
I just want to say, I mean, we've actually leveraged the fact that there's genetic data available, and my colleagues actually were able to get the DNA samples from NHANES participants and measure telomere length in them. And so from that, we were able to publish some of the biggest studies to date on environmental chemical exposures. And
now wait, you need to tell them what's a telomere and why is that important. I'm sorry.
Yes, so telomeres are the ends of DNA material at the ends of chromosomes, and they help promote chromosomal stability. And as the cell divides, telomeres shorten. And once they shorten past a certain length, it leads to cellular death and impairment in function. And so telomere shortening is a risk factor for cardiovascular disease and chronic disease. So it seems to be a biomarker of various environmental stressors, including some of the chemicals we've been talking about today.
And obesity. And stress.
Right, yes.
And stress. Yes, Dr. Hu, Valerie Hu.
Right. My name's Valerie Hu. I'm in the Department of Biochemistry and Molecular Medicine here at GW. First, I want to start off by thanking Dr. Birnbaum for an excellent talk, as well as for her and the NIEHS's support of our research on environmental contributors to autism. My question is directly to Dr. Birnbaum with respect to what you said about the association between high molecular weight phthalates and later puberty in females. Mm-hmm. I'm wondering if there was a sexually dimorphic effect with respect to the exposures to those compounds. Is there a difference with respect to puberty in males?
Unfortunately, that study only was dealing with girls. Okay. Because it was part of the breast cancer and the environment program. Uh-huh. So it had recruited a cohort, well, it recruited 3 cohorts, different ethnic groups in different parts of the country, mm-hmm. of girls when they were about 6 or 7, and is following them over a 10-year period. Uh-huh. So many of them are gone through puberty now, and they were being followed for all kinds, and lots of biospecimens taken and so on over the time. Yeah. So there were no boys in that cohort, and I'll tell you, it's actually kind of frustrating because a lot of the cohorts are only girls that we have, and a lot of the children's cohorts. And not only do dads matter, but boys matter too. And among the only studies that I can think of with puberty and environmental chemicals in boys are some of the studies that Russ Hauser and his colleagues have done in Russia, mm-hmm. where they have shown some associations with some persistent organochlorine pesticides mm-hmm. and time to puberty in boys. So, I think that's a real data gap.
Yeah. That's interesting because, as you know, most of the studies on autism have been done in males. So it's going to be hard, with males. So I think it's very important, especially when we're dealing with endocrine disrupting compounds in the environment as possible contributors to autism, mm-hmm. that we need to look at the effects on both sexes.
So we have a number of cohorts of young children we have, especially at the University of California, Davis, mm-hmm. we have several studies there where they started out initially recruiting young children at the age of 3, which at least kind of traditionally has been an age that you could definitely say a child was autistic or not autistic. And they compared been following these children and comparing them to normally developing children and then children with other kinds of developmental delays. And then what they've done is if you have one child with autism, you have a 20% chance for each subsequent child that they might fall on the spectrum. And some people will say that's a clear evidence for the genetic contribution, which may be true. It's also, I would say, a clear evidence for environmental contribution, because in general, people don't necessarily pick up and move when they have one child with autism to something else. So there may be similarities there. And so we're following now, and there we have some information on preconceptional, both partners, for example. We have information on the second child, and then we're going to be able to follow them. And the reason so much of the work on autism is done with boys is because the ratio is 4.5 to 1, more boys than girls.
Right, but the other thing, aside from picking up and moving, so changing your physical environment, you don't change the uterine environment for the second child as well. So if the maternal environment is, what it is for the first child with autism, it's likely to be very similar for the second child and the third and so forth.
It depends, though. I mean, there are things that happen, such as persistent substances. The levels, the body burdens go down with each subsequent child. If your exposures are earlier, if you're continuously exposed, I don't want to get into an argument.
You need to see the paper that I just published, and we can talk about it.
Next speaker.
Hi, my name is Zoe Petropoulos, and I'm going to switch gears and ask a policy question. So since we have a new president and administration coming in less than a year, hypothetically, if you got to sit down with that president, what initiatives or what efforts would you want them to put in during their tenure to advance this field and also to improve the translation of the findings into interventions and public health programs and policies? What would those really, think high level, so would you want something like Cancer Moonshot or the Precision Medicine Initiative, or just more funding? What would be the most high-impact policy change? And then is there something out of Congress that you would want changed as well, more than just maybe passing a new TSCA reform bill? What would you need, or what would you want?
So I don't know if the members of this panel are all, prepared to address that, but I'm going to go ahead and lob it to them to see what they'll say. Starting here.
I think I better pass on that one.
You'll pass.
Well, I think in addition to how EPA regulates toxic substances, a thorough review and changes in food, we were talking about this before, what FDA regulates and how they regulate both the food, food is a huge, very important to people. People are very concerned about what they're eating, but I think there's a lot of potential for exposure there that a lot of people don't have control over. As well as cosmetics, another big area that impacts everybody that's largely unregulated right now. I would also want attention to our nation's most vulnerable communities, because right now they really do often carry disproportionate burdens, and these disproportionate burdens are not adequately taken into account when new decision making is made about where industries are placed, or what infrastructure is updated, and those other types of decisions. So those are some areas that I think it would be good to have higher level interventions.
Rebecca, did you want to?
I would just add to, in general, increase funding. I think that is probably the key. And then, to target specific populations, what Dr. Zota was talking about.
So I would say money, because we know that with more research we can make better decisions. But I do want to stress that regulatory change and policy changes have a much greater impact at a much lower cost than, for example, personal decisions or medical decisions. There was a study that David Bellinger and co-workers did a couple of years ago where they compared the cost of medical treatments to policy change. And again, the policy changes are much more effective. It's very hard to make people change their behaviors. And yet policy change, it's hard to get policy change too, but that is where I think effort should be put to make some changes. And Ami just alluded to the fact of unfortunate substitutions, which is the polite way of talking about whack-a-mole or the chemical conveyor belt, which is what tends to happen is one chemical is shown to be problematic, like some of the high molecular weight phthalates. So then they come up with ones that are a little lower molecular weight, and guess what? They're not tested, so okay, they're fine, but when some people start studying them, they turn out to be just as bad. And this is happening with a whole series of different kinds of substitutions. So I'm sure everyone in this room got rid of their Nalgene bottles that had BPA in them because of concerns with BPA. But now we're finding that what's in those bottles now may be every bit as bad, if not worse, than what was put in than the BPA was. So, you jump from what you know is bad to something that you know less about. And I think it'd be really nice that if we would test things before we expose people to them.
So I'll give a response as well. And I think that one thing that I found kind of disappointing, actually, to somewhat in terms of the cancer moonshot, has been that so much of the emphasis has been on speeding the development of new medical treatments for cancer, when yet so much of cancer is preventable using knowledge that we already have. And I don't think that we can treat our way out of the cancer problem. I think that the CDC, that for a long time has said 30% of cancers could be prevented if we applied what we already know. And Dr. Birnbaum showed you the enormous annual costs of environment-related disease across the world and in the United States as well. And my mantra would be prevention, prevention, prevention. But it's not that simple. We need research to inform prevention. We've talked a lot in this country about translational research and the precision medicine initiatives about translation, basically, of what we know to medical treatment and personalizing medical treatment. But I think that we also need research that helps us to translate to better population and public health.
So Lynn, I'm going to jump in because it's really important to understand that the National Cancer Institute now has put out a call for people to comment on the cancer moonshot, and they're looking for suggestions of what should be done. And I've been talking to Doug Lowy, who's the acting director of NCI, and talking about the need to have prevention as one of the major goals of the moonshot. So I think if people, put that into this call for information that NCI is looking at, it'll be a way to at least hopefully get them to address that issue.
And somehow the deans of the schools of public health all wrote a letter too, and any of you also can contribute and can help to shape this. But this is a policy of this administration. So I guess another message that I would have has to do with the need to have strong continuity of some of these initiatives from one administration to the next. And the fact that one of the things that has certainly plagued efforts like the National Children's Study has been, with changes in administration, you have support and then you don't have support. You can have management of a big study like that flipping over. And I think that we see, and especially with Linda's engagement, the ECHO study is starting to take shape. There's a new director. But will a next administration stay the course? Will they own it? Will they care about it? Will they move it forward? This is something that all of us need to be aware of, so that if they ask us, what do you think, that we would certainly say, yes, stay the course with some of these things, because it's always tempting for new people to want to create their own thing, that it's called something different, looks like something different, that is theirs. We have a next question.
Hi, Jennifer McPartland. I'm a senior scientist in the health program at Environmental Defense Fund. So throughout your presentations, many of you gave really great examples of specific environmental exposures that we have come to understand are associated with various health outcomes. But I'm sure also all of you know that the vast majority of chemicals out there in the marketplace are very poor, are very data poor, and you've already started to exemplify that with the situation of regrettable substitutions. And so I'd like to ask all of you, how do you think, and maybe this might be directed to Dr. Birnbaum first, these new novel emerging methods like the exposomic centers coming out of CHEER, as well as the predictive mechanistic-based approaches coming out of Tox 21 and NIEHS can help move the ball forward in terms of filling those data gaps, while also simultaneously appreciating the biological complexities of the very health outcomes that we're trying to predict chemicals maybe have an effect on.
Okay, so that's kind of a multi-part
Yes.
question.
Guilty.
So you talked about the exposome and you talked about the Tox21 and how these could be integrated or used together. So Tox21, for those of you who are unfamiliar with it, is a cross-agency effort that involves two parts of NIH. It involves NCATS, which is the National Center for Advancing Translational Science, and NIEHS. It involves EPA's Office of Research and Development, and it involves FDA. And what this is doing is developing rapid, high-throughput screening and also mid-throughput, different approaches, so that we can test more chemicals more rapidly. You know, the maximum number of chemicals that are, say, tested in experimental animal models in the long-term cancer studies is about 8 to 10, which is a very small number of the 80,000 or so chemicals out there in commerce, about 60,000 of which we know nothing or virtually nothing about. With some of the approaches, I used to not be a believer in these high-throughput in vitro kind of approaches, but when instead of running 10 chemicals or 100 chemicals, you run thousands of chemicals. And instead of looking at 1 or 2 or 3 different kinds of endpoints, you can look at 600 different kinds of assays or 700 different kinds of assays. You begin to see patterns evolve. And in fact, what you can see is that looking, and we've looked at over 10,000 different individual chemicals, and what you can see is that maybe 10 to 15% of them are what I would call the bad actors. 20% of them, 15 to 20%, do nada in anything, and the rest do a little. Well, where am I going to put my effort? I'm going to focus on those ones that appear to be the bad actors in some of these high-throughput studies, and I'm going to move to doing some of the mid-throughput approaches, like using worms, C. elegans, or using things like Drosophila, or for vertebrates using zebrafish, which are one of my favorite models, where in fact you can run hundreds of individual fish through hundreds of different chemicals and begin to understand what's happening in their endocrine system. Are you messing up development? For those of you who don't know, zebrafish, for their first 5 days of development, and their whole life cycle is only 3 months, they are totally transparent. So you can watch the heart forming, you can watch the brain forming, you can watch, it's absolutely an amazing thing to look at. They have to do it with a microscope because they're really little, but that's okay. But I think that those are some of the kinds of approaches that we have to use. We also are doing a lot of computational modeling to identify factors which may be problematic. And as we were talking, or as I was saying with the unfortunate substitutions, when you move from one chemical to another, because you don't want to have to change the industrial process, so you just change one functional group or something, why would you think, if it doesn't change the industrial process, why would you think that's going to not change the biology? There's kind of, we don't always think through what we're doing. I would also suggest that a chemical that is biologically, especially highly biological active in many different kind of assays, is likely to cause lots of different adversity. It's going to be a function of when did the exposure occur, like during what susceptible window, was it acute or was it chronic, and what were the doses that you used, plus what's the entire matrix that you're dealing with. What's happening, what's going on in the diet. We know, for example, that if you expose experimental animals to chemicals on a low-fat diet, you get a completely different response than if they're on a high-fat diet. Well, what does that say about the American public, where most of the American public eats a high-fat diet? You can begin to look at, but I think these are the things that we're beginning to look at. And I think we're going to need some very complicated computational approaches to understand it all.
Mm-hmm. Thank you.
Thanks.
One last question for this session. Dr. Pelfrey. Hi, Kevin.
Dr. Pelfrey, George Washington University. And one comment and then a second comment / question. I have been involved in autism research now for 14 years. And it occurs to me, no one's ever asked, what would you ask for from the president if you could? And so how happy I am to be here, where that's a posable question, and the president might listen.
Could we ask you that question? I mean,
no, but so it's really extraordinary. So I'm glad to be here. And then we've been doing research. We know autism has been a very genetics-heavy field, and part of that is the history of the vaccine controversy and blaming parents for environmental insults caused by bad parenting, and then the vaccine vector sort of coming in and really killing all innovation in environmental work around autism because it's so hard to get it funded. And then ramping up, the genetics, and also with the sort of genetic revolution, that work has been heavily emphasized. And it occurred to me as people were talking, we now know our major contribution to the science of autism is that about 20% of autism can be accounted for by de novo mutations that are found in children, usually copy number variations or single nucleotide variations. And so they're de novo, and that's exciting to we who are in genetics because we can start to trace the pathophysiology. And it's been adequate to just call them de novo. And then it occurred to me, no one has ever asked in as many meetings as I've ever been to, well, what caused the mutation? Right. It's just enough that it's de novo. And so there are actually thousands of subjects at this point where we've characterized carefully everything you can about the parents, their current psychological state, about their genetics, about their brain. And we've never asked a question about anything related to environmental exposures. And many of our grants are funded towards identifying the next member of the family born to see, are they going to develop autism, infant SIB studies, this is called. And I'm stunned by the fact that we haven't taken the opportunity to do essentially birth cohort designs where we know the genetic lesion that's de novo, and we can say, is there going to be another one in this child? And then what is the cause? And we can follow the parents' preconception. And the parents will be very willing to participate. They'll wear anything you want and do anything you want because of the return is that their child is so closely surveilled. So more of a comment, but I think what I've noticed in the policy world of this, sort of sitting on the Interagency Autism Coordinating Committee, the voices of those studying environmental impacts are quelched. What we do here is from parents often talking about vaccines, and we scientists sort of zone out at that point. But there's something beyond that I think I'm really impressed by the amazing science presented here today, and I think something that GW could be uniquely strong in because we already have access to this data. Now we have access to this amazing Institute for Public Health. So, long comment. Sorry.
Well, we'd love to open a dialogue with you. I sit on the ICC also. I don't always get there, but to those meetings. But we've ramped up our autism portfolio dramatically. I'd say over the past 6 or 7 years, going from only about $1.5 million a year to now about $12 million a year. We've had a couple of FOAs out there. Those are funding announcements related, and we do are funding a couple of SIBS kind of studies where some genetics are being looked at in those studies, but much more focused on environmental. And I think it'd be great if we can get together and cross them, because that's what we need.
So that's really the science is going to be at the interaction. Yeah. We still haven't found a gene for any neuropsychiatric disorder specifically. Right. And so it's always about the interaction.
That's right. Thank you so much for that. And thank you so much to our panel, and especially to Dr. Birnbaum for what's been a wonderful session, and to those of you in the audience who participated in the discussion. It's been great. I think we're going to have...
No, if you could give a great hand to the team here. I mean, Lynn and ICF and others who helped put together a great panel today. If you could give them all a big hand. But on that note, after listening to Lynn and Linda, I'm questioning if two of them were separated at birth somewhere. But thank you all again. Appreciate you coming today.
Thank you. Thank you.